bald-headed guy come walking in, and he kept on staring at me, and I felt like saying, "What are you, a pervert or something?" and he finally said, "Hey, kid, is it true that you really go to high school?" I said, "Yes, sir." He said, "Well, why don't you think about college?" I said, "No, I can't do that." He said, "Why?" I said, "Well, I'm kind of dumb. I'm not too good in school." He said, "You know, it's a funny thing, and this is probably an important point. People coming into your life." He said, "I watched you wrestle since early this morning, and you're not dumb." And he said, "I'll tell you what." He said, "Give me your name and address, and I want to write you a letter." So I said, "Okay," and I forgot about it. 2 weeks later, I got a letter with a round-trip ticket to Providence. I live in a little town near Boston. And I said to my father, "I'm going to go up to Brown University." He said, "What are you going to do that for?" He said, "You'll never be able to go to college." And I said, "Well, what the heck, it'd be a free meal, Dad." And so anyway, I went up there, and they took me in this room, and for 2 days they gave me tests. And I remember one of them was an ink blot, which really kind of tickled me at the time. And then I went home. They never said much. I got some free meals. And 2 weeks later, I got a letter from the Dean of Admission admitting me to Brown University without even an application, which, okay, well, that sounded pretty good. But next slide. And then something happened there. First, it was like a kid in a candy store. I could take all the courses I could do and completely ignore, I thought, the ones I couldn't do. So I did that, and I was real good in history, and they admitted me to a seminar course in this little old library here, John Carter Library, and that was my first real change in life, because what happened is these kids, like were senators' children, poets' children, they'd been around the world, they read, they went to museums, they knew all that stuff, and I sat there, and I said, "You know what? I'm not dumb, I'm just ignorant." And I said, "And you know what? That's probably fixable." So I subscribed to the New York Times, true story. Okay. The other thing I noticed in talking to them, there was a whole world in your mind, and that was introspection. I used to say, "What does this mean in the great scheme of things?" But I realized that you could look within rather than look without, and that was an interesting insight for me. Next slide, please. Then reality came up. I was doing great in college. I was Phi Beta Kappa. I was on the dean's list. I was captain of the wrestling team. I was undefeated for 3 years. I was having a ball, and I got another phone call, and this was from my advisor. And he said, "Hey, Mark, do you realize you haven't taken a foreign language course, and you can't graduate from Brown unless you're proficient in a foreign language?" And he said, "What language do you want to take?" And I said, "Well, I flunked French 3 years in a row." So I said, "Well, I'm proficient in French." He said, "All right, I'll sign you up for a beginning course." And I knew in my heart I could never pass French. So I said, "Well, is there any other way to do it?" And he said, "Yeah, you could take a French proficiency test, and if you pass it, you don't have to take a language." Well, the gym was 3 miles away from the campus. So I bought these little cards, these little index cards. On one side I wrote English word, the other the French word. And for the next 2 weeks, I walked back and forth to the gym and memorized the whole French vocabulary without knowing any grammar or anything else, okay? But because I could figure it out, I took the French proficiency and passed, and I got away with it, okay? And I thought I was going to get away, and then I decided, and I won't go into it because for time reasons, to be a doctor. But what happened was I forgot to sign up to be a pre-med. So what happened then is, well, I applied to one medical school, Tufts, and they looked at it and they said, "Here's a guy who's graduating summa cum laude, he's got high honors, he's the captain of the wrestling team, he's an undefeated athlete." So they took me, and I think they forgot to look at that I didn't take basic science at all. And then I got in a real serious trouble because I made one other mistake. I moved in with some other students, and I tried to study and learn like them. And at the end of a couple of months, I got a call from the dean, went in, he said, "Kid, you're flunking out." And I realized I was. I mean, I knew it. And I don't know why I did it, but what I did is I packed up my bags and said, I gotta teach myself. And I moved back to my parents' home. And what I did is I'd go home at night, have dinner with my parents, and then go to bed. I get up at 2 o'clock in the morning and set up my own medical curriculum. And I did it with the New England Journal of Medicine that has what they call CPCs. They're case studies. And what you do is you study it, and then it's like a whodunit. So I would get all of them, read them, and then I'd have all the books, and I'd teach myself that way. And I managed to stagger through medical school the first couple of years. Then I got in the clinical part, and then it was easy. And so that worked out pretty well. And next slide. Then I got an insight. I realized things like pH, when they showed me that, I just blanked out. So I said, these are these complex physiologic things. How the heck can I understand them? And I said, you know, by drawing pictures. So I got a book on cartooning, and I decided to draw my pictures for all the physiologic things. And it's interesting. This is from the standard textbook in pediatric surgery, talking about the gut barrier and these little bacteria jumping over the hurdle to cause sepsis. And so I used to do that with all my slides. And believe it or not, even though I didn't like public speaking, I became a very demanding public speaker because I had neat slides and seemed to be able to explain things. And these little stars are the places where I've either given endowed lectures or visiting professor lectures within the world, which always staggered me because I figured, what the heck am I doing here? But it was really because of the cartoons. Next slide. I decided to be a surgeon in a funny way. I didn't like the other students because all they talked about grades, so I didn't want to eat lunch with them. So I wanted to find a quiet place, and that was the surgical amphitheater. So I used to eat my lunch watching the operations in the surgical amphitheater. Honest, it's a true story. And what happened was, the surgeons noticed me up there and said, what the heck are you doing up there? And I told them, and they said, well, come on down and really see what we're doing. Got friendly with them. They asked me if I wanted to work with them in the animal lab doing research, and I said, yeah. So after school I'd do, and they taught me how to do surgery, and that's where I realized I found something not only I was good at, but I loved it. And you know, it was funny. When we have what we call train wrecks, terrible, terrible case, and we're closing it up, it's 2 o'clock in the morning, but we knew the kid's gonna really do well. And we'd look at each other and we'd say, you know, if they didn't pay us to do this, we'd pay them to let us do it. So that was a blessing, to find something that you could do well and that you loved. And I was very lucky. Next slide. I had my training at Boston City Hospital, which is a big charity hospital. And if you know anything about the old days at Charity Hospital, no supervisions. The motto was, see one, do one, teach one. So in other words, I watched somebody do an operation, then I did one myself, and then I got an intern and showed him how to do it. It wasn't, and that's the way it was in the old days. One night, and I was on an admitting team when I was an intern with a senior resident, and one night they would operate and admit, and the next day we would clean up, take care of the patients. And the worst and most difficult diagnosis is whether to go back in if there's a problem post-op. Very hard to diagnose. So we were the cleanup, and Dick and I, the senior resident, would go back and operate on these guys in this little old dirty Boston City Hospital. And one night at 2:30 in the morning, we're sitting there and trying to decide whether this old alcoholic who had a stab wound was leaking and had to be taken back to the OR. And Dick was sitting there with his head like this. And I was tired as anything. I said, what the heck are you doing, Dick? Let's decide and get the heck out of here. And he says, shh, don't say anything. I said, you know, you're cracking up. He said, no. He says, I'm listening to the little men. He says, back here are these little men. They don't go to the grand rounds. They don't go to the journals. They don't read medical journals at all. They don't go to conferences, and they only talk in whispers. But if you listen very carefully, they always know the answer. And as soon as he said that, you talk about aha experiences, I said, son of a gun, he's right. And for the rest of my career, I always listened to the little men, and it's kind of a family joke because the kids would say to me, hey, Dad, what do the little men say? But I take this very seriously. Next slide. I'm going to jump ahead to being a pediatric surgeon and tell you a little bit about, these are sort of observations that I never understood, and some of them I still don't, but I found I did things different than other people. And, you know, this has been a tremendously enlightening time for me, meeting you people, because it seemed that I was coming around from the other end. And the way I operated 3 times on a difficult case. The night before, I'd kind of sit down somewhere, and I'd start doing the operation in my brain. And I'd actually see it, even the incision, and I'd figure out, well, I better not go there, I better go there. So then, when the operation started, I could just sort of walk up to the table, pick up the scalpel, make the incision, and get going. Okay. The other operation I did was the night after, and I always said that was the most important one, because I do the operation all over again and was very, very unhappy. I think only once in my whole life have I ever been happy with the way I did it. But I would go through it again and say, next time I'm going to do this, this, and this. You know, and it was what I call lessons learned. But an interesting one, which I never figured out, and this is actually a picture of me that somebody snapped in the operating room sitting beside the table. And what had happened in this case is there's a thing called thoracic dystrophy in newborns where they're born with a chest that's crushed like this. So even though they got normal legs, their lungs can't expand. So as a result, within 2 days, if they have severe respiratory deaths, they all die. And I kind of got sick of seeing these little kids come in and dying, and I decided I was going to open up the chest and let the lungs expand. And I kind of figured out how I could do that, and so I did. And I got the chest open, and the lungs expanded just like I thought they would. And the anesthetist said, that was great, you've got oxygen now. And so then I look down there, and the heart's beating, the lungs are out there, and I try to get it together. And of course, every time I pulled it together, it pushed the lungs together. And I kind of said, uh-oh. And so what I did, and I'll never forget it because I didn't plan this, I sat down in a chair by the operating room. You can see I've got my hands folded so I don't get contaminated. And this was actually this is a picture of me in that particular situation. And I started doing 3 different operations in my mind. And the third one worked. And then I went and I did it, and it did work. So it was interesting because it brings up the whole thing about how dyslexics visualize and so on. Next slide. I was reluctant to show you this slide, but because this is a very personal thing. But I decided to show it to you because I don't know what part of our characteristics this takes into consideration. And this is a beautiful family. It's not the actual family, but the rest of it is an actual case of a beautiful little boy and 2 loving parents who treasure this child more than life themselves, okay? Unfortunately, this is a CAT scan of this kid's malignant neuroblastoma. And here's the spine, here's the belly, here's the liver, and this entire space is filled up with this massive malignant tumor, and this is the spine right here. And if you look at this picture here in the dotted lines, this is involving all those vital structures. What we used to say, it's where the kid lives. Now, this is not to be dramatic, but this is actually what happens, okay? I have to decide if I cut right about here, see if I can get this thing to go. Okay, if I cut right along that dotted line, it's a safe area, okay? But